We're gonna do a little room check. We have the patient chart and the MAR here. Looking good.
All right, guys, so today we are in the hallway and we're going to review our patient's chart before we head in. So our patient today is Joanne Peterson. Her birthday is 12/10/47. She has no known allergies. She is a high fall risk and a full code. She's in here because she fell and her son found her. And today we are going to talk to her about her heparin. So that will be 5,000 units per 1 milliliter of heparin. We will advise her of the risks and where we will inject that. So let's go meet our patient. Knock, knock, knock. Hi, Joanne. My name's Emma. I am your nurse today. So can I get your name and date of birth? Awesome, matches that. Perfect. All right, so I'm just in here today to talk to you about your heparin. Yep, you had this yesterday. Yeah, so it's just a little shot in your tummy. The heparin is to help prevent any blood clots because you are a high fall risk, so you can't get out of bed or anything like that. And we just want to make sure you don't get those. Some side effects are, extra bleeding. So you may, if you brush your teeth too hard, your gums might bleed. And if you bump into something, you might bruise more easily. Yep, so we're just giving you 5,000 units of heparin, which is just 1 milliliter. Yep. Do you have any questions about that heparin? No? Okay. Yeah, and I saw in your chart you don't have any allergies. Is this still true? Okay, awesome. All right, so if you have any other questions for me, you can hit your call light, but I'm going to go get your heparin ready, okay? All right, so bed is in the lowest position, room is clear, call light is with patient. All right, so now I did hand hygiene, leaving the room. I'm going to do hand hygiene again. And then I'm going to put on some gloves and we are going to do our first med check. So right now we are administering heparin, 5,000 units per 1 milliliter. And that is to prevent the patient from having any blood clots. It is for Joanne Peterson. Birthday is 12/10/47. Here we'll see that the heparin, 5,000 units per milliliter. Perfect. Set that back down. We also made sure that the bottle was clear. There wasn't any gunk in it or anything like that. So now that we've done that first med check, we are going to draw up the heparin. So I'm just going to open this first, which is our syringe. And then this is our blunt end that we will use to draw it up because we don't want to damage the needle that we'll be actually putting in Joanne. And because this is a shared dose bottle, I'm going to make sure to scrub it for 15 seconds. My 15 seconds is up. We'll set that back down, let that dry for 15 seconds. And then what I'm going to do is I'm going to pull this out, making sure the top of this stays sterile. And then we're just going to put that in this lure lock. Perfect. So now we can see here, safe, needle is good. And because we are giving her 1 milliliter of this, I'm going to draw up 1 milliliter of air once I remove the cap. Let's see, that's not perfect. Drop 1 milliliter of air, which you can see right there, 1 milliliter of air. Now I have let my heparin dry for 15 seconds. So I'm going to take this and I'm going to put the blunt end right in there, inject my 1 milliliter of air. And then I'm going to flip it upside down and draw up 1 milliliter of heparin. So I'm going to drop a little bit more than that just so I can try and counteract these bubbles here. So I'm going to flick it to make sure all bubbles are out. That's looking better. All right, there is 1 milliliter. Perfect. So now I'm going to go like this. We're going to remove that. And then I am going to do this a one-handed technique, and then I just go like that. Perfect. So now that I have this, I'm going to write on a piece of tape. I'm going to have a JP HEP, and then I will write that it is SUBQ. That's just so when I bring it into her room, I make sure that I have the right medication. All right, we'll just wrap that around. And now we are going to go back into Miss Peterson's room. Yeah. I'm going to bring the needle with me. And we are going to do our second med check before we go. So we're just going to make sure that I do have 1 milliliter of heparin, which is kind of hard to see now because I put the tape over it, but that's that. We're making sure this is for Joanne Peterson. This is the 5,000 units per milliliter heparin. I'm giving it for the right reasons to prevent her having any blood clots. I'm giving it at the right time. It's due right now. It's the right medication, the right reason, and I will document after I give this to Miss Peterson. All right, so I'm gonna grab all my stuff, and now we're gonna walk into Miss Peterson's room. Knock, knock, knock. Hi, Miss Joanne. I've got your heparin here, okay? All right. So I would obviously put on new gloves, and I'm going to perform hand hygiene. So we do that, and then I'm going to put on new gloves. And I am also going to conduct my third med check at this time before I administer this. So we know that right here. Miss Joanne, can you verify your full name and your date of birth for me? All right, awesome. All right, and then I'm making sure I have 1 milliliter of heparin, good, and it is the correct dosage, 5,000 units per 1 milliliter. And then I'm just making sure we're giving it for the right reason, which is to prevent any blood clots. The right time is right now. The right, I have the right dose. I'm doing it through the right route, which is SUBQ. So we will get ready and do that. So Miss Joanne, I'm just gonna go ahead and remove your blankets a little bit, okay? So I'm just moving her blankets, making sure that she's not totally uncovered. We're gonna go like this, just to make sure she still has good privacy. This alcohol pad is gonna feel a little cold on your skin, okay? All right, so I'm gonna work from inside to outside, just going like this for 15 seconds. All right, my 15 seconds is up. Now we'll let that dry for 15 seconds. And then I'm going to put on my, so this is a 23 gauge. It's 0.6, or it's a 5/8 length needle. This is good because we're giving it sub-Q, and we don't need to reach past that muscle. And with this, I'll give it at a 90-degree angle because Joanne, she's not emancipated or anything, so I don't have to kind of get that extra fat. So I'm just gonna do a 90-degree angle with the bevel up. So let me open this up now. All right, and we do want to keep this sterile. So I'm just gonna remove this, the blunt end. Now I'm gonna discard of it in there. Now I'm gonna take this, and we're gonna go just like that. Perfect. And you can see we have the safety lock here. I'm just gonna pull that back, and then I'm going to remove this if I can. There we go. All right, so then I'm gonna make sure the bevel is up. So you can't really tell because it's really small, but the bevel is up. And now I'm just going to kind of squish Joanne right here. Yep, and my alcohol wipe is dry. I've done 3 med checks. All right, Joanne, you're just gonna feel a quick pinch, okay? And what we're gonna do is just go in at a 90-degree angle, just like that. And we're gonna administer slowly. I did have to pull back a little bit because of the mannequin, but once we've done that, there's no bleeding or anything. And then I'm gonna just come over here, do my safety lock. It locked, so we're all set there. I'm just gonna put the whole thing in the sharps bin. There's no bleeding. Are you feeling any immediate pain down there, Joanne? No? Okay. All right, and if there was bleeding, I could put a little pressure or I could put a Band-Aid on it, but she's good. So we'll just cover, I do hand hygiene first. All right, I'll just cover Joanne back up. All right, Joanne, so I'll come back and check on you in about 15 minutes. Do you have any problems right now that you wanted to ask me about? No? Okay. Well, you can always hit your call light. If you do, bed is in the lowest position. She's got her call light right here. I'm gonna take my MAR and this back to the med room where I will document. All right, Joanne, I'll be back in 15 minutes, okay? All right, we'll come back. Put this back in the bedroom. We'll document. I did the right documentation, and that's it.